So I did my own research on all of the qualifying conditions, identified and separated what research studies, primarily most of these studies were out of the country, some funded by the NIH, which is our federal government, but out of the country, that demonstrated double-blinded randomized trials that demonstrated benefits and what aspects of the cannabis were beneficial for the patients. And I created a complete algorithm to train and help other physicians learn how to properly and safely dose patients with cannabis. And I'm reading these research studies because I was sitting there trying to look and find what the mistakes were. You know, why would this not be necessarily true? And after you read study after study by different research scientists that demonstrated that there is value and repeatable value, then I have to agree that it is beneficial for patients. So in order to understand medical marijuana and how it works, we have to understand the endocannabinoid system. Everybody understands the digestive system. We understand the neurologic system, the cardiovascular system, but we didn't know that the endocannabinoid system even existed until 1992. And it was never taught to physicians in medical school back then. And I'm not sure if it's even being taught to students now. I know I didn't learn about it back then. But the endocannabinoid system was isolated by Dr. Raphael Mechoulam. He's a scientist out in Israel. And he isolated THC. And he isolated it from the plant. It was fascinating, like, how does this work in our bodies? So once we got the little molecule, he traced it back, and other scientists got on board to find out where it acts on our bodies. And we have different CBD receptors. We have CBD1 and CBD2 receptors that map out in our bodies throughout, and that's how we discovered the endocannabinoid system, and it regulates everything. And the whole concept behind, or the thought behind a lot of these 21 qualifying conditions is that our bodies don't make enough of our own endocannabinoids, so we may be deficient. They're like, we make equivalents of THC and CBD, which are the plant materials found in medical marijuana. We make our own. They're called 2-AG and anandamide. And if we don't have enough of those, that's the thought of why the plant material then replaces what we don't have enough of, and then just creates the uniformity that we're supposed to have with our endocannabinoid systems to give us relief from an autoimmune standpoint, from a pain standpoint, from a memory processing standpoint and PTSD. So that's the concept behind why it works, because it replaces what we might be lacking.
So it's not just that these people are getting high and that's why they feel well. It is actually possibly slowing processes.
Slowing processes, blocking inflammation, or even accentuating or replacing processes. So people who have post-traumatic stress disorder, the whole concept is when they have a horrible event, something goes wrong with their memory processing. And there's the hormone we make in the endocannabinoid system called anandamide. It's found to be very low in patients with PTSD. Whereas if you give them medical marijuana, it helps them process that memory, so not that they're reliving it over and over again, but instead that they're viewing it almost like on the television, and they don't relive those same feelings. So it's different for each disease process, so it's really fascinating. I could talk about Alzheimer's forever because it is definitely one of the qualifying conditions where medical marijuana is very beneficial. But the number one thing that makes caregivers have to place their loved ones is when those Alzheimer's patients lose their sleep-wake cycle. So during the day, they're taking a nap and the caregiver's like, finally, I can get something done. Let me get dinner ready. Let me get this done. Let me get this done. But in the evening and at night, that Alzheimer's patient is up and they're active and they're agitated and they're hypervigilant, and the caregiver is exhausted from everything that they had to do during the day, and now they can't sleep at night because that Alzheimer's patient is awake. Well, guess what medical marijuana does? It helps to re-regulate that sleep-wake cycle. It decreases the agitation. So you would think that if we were getting this Alzheimer's patient high, they would be more paranoid, that they would be more hyperactive, that they would be more of a problem, but it's the exact opposite. They stay awake more during the day, they're less agitated, rested at night and they sleep better at night. So the number one reason why a caregiver has to decide to place their loved one in a facility is now improved, and they can keep their loved one at home longer by giving them medical marijuana. And the other thing I didn't mention is that medical marijuana also helps to slow the progression of the Alzheimer's. So not only can you keep them home longer, but you can also decrease how aggressive that Alzheimer's is going to be for them.
You mentioned the word CBD. So if I understand correctly, we've got two elements, THC and the CBD, and you might be recommending, not you personally, but a doctor might be recommending a mixture of the two, or maybe more of one than the other, according to what you're trying to treat.
Very good.
All right, I got that.
Yes, absolutely.
Yes. So can you please give the explanation or definition between the two, and therefore to what would be the difference, the CBD oil, which is quite popular right now?
So CBD oil doesn't have or should not have THC in it. And CBD oil is, there are a lot of legal issues in the state of Ohio associated with CBD oil we don't necessarily have to discuss. But the difference between the two is that with medical marijuana, there's both components there. And just that little bit of THC, it doesn't have to be a lot, if in the medical marijuana product, helps that CBD act and be more efficient and more effective. It's almost like, the analogy I use is almost like Miracle Grow. You can add water to a plant, but if you add a little bit of THC to that CBD, it makes it work even better.
It's like a booster.
It's a booster. It's a booster. So patients can have a better effect at a much lower dose.
So we've talked a little bit, benefits, advantages, but how does one know how much to take? How would a doctor know how much to recommend? So let's go into the variety of ways that it would be administered.
Correct.
And how you would know how much to take.
So for novice users, or people who have never used medical marijuana before or used it a million years ago and haven't used it recently, we like to recommend vaporization. And there's such a stigma with smoking marijuana or vaporizing or even just vaping products. But the clarification that I want people to understand is that that's actually the most pure way of utilizing medical marijuana. So you're taking the plant material and you're vaporizing the THC and CBD and making it boil and go into the vapor, just like if you're making pasta and the pot is boiling, and you're inhaling it like an inhaler. And in the state of Ohio, we test for pesticides, we test for molds, we test for mites, and a product's not making it into a dispensary if it fails any of those tests. So the good news is when you're vaporizing the purest form of that plant without any surrounding contaminants. And because you're vaporizing, you get an effect relatively quickly. So when you dose, if you feel relief, put it down. You'll feel an effect within seconds, up to 5 minutes. If you don't feel relief, then pick up the vaporizer after 15 minutes and redose again. So it's very difficult to overdose if your goal is just to get relief, if your goal is just to have an improvement in your spasticity if you have multiple sclerosis. Our patients are not interested in getting high. They don't want to get high any more than they want to have diarrhea. It's a side effect. They want to have a better quality of life so that they can function. You know, we have patients who have stage 4 breast cancer and young children, and they want to be able to have enough energy so that when those kids come home from school, that they're able to function. And the last thing they want is to be inebriated or intoxicated with cannabis. So there's our physicians sit down and have a long conversation with you. Before the patient even comes in, we have a copy of their medical records. We have a good idea of what treatments they've had before, and we have a little bit of a preconceived notion based on their other physicians' notes about what they need and what they would benefit from. Then we sit down and have a conversation with them. Say, for instance, this is a patient who has chronic pain, and if they have severe and chronic pain, what we would do is multimodality therapy. If you want to be awake and active during the day, then we would recommend a product that keeps you awake and active during the day while still giving you pain relief. But if you also have difficulty sleeping at night, then what we would do is dose a different product or recommend a different product to take so that they can sleep throughout the night. So vaporization is effective for 2 to 4 hours, but an edible is effective for up to 6 to 8 hours. But if you eat something, your body has to digest it. So you may not have an effect from that edible for up to 90 minutes.
So might there be a problem where someone says after a half hour, oh, well, this didn't do anything to me, so I'll just take a little bit more?
That's why we're not a fan, our physicians are not a fan of edibles as your first line of therapy, because they'll take one and like, I don't feel anything, this is nothing. Then they take another one, I don't feel anything. Well, that dosage then compounds, and about 2 to 3 hours later they may have an experience that's an absolutely negative experience that may preconceive them to think that medical marijuana is not right for them. And that's unfortunate. If they were properly dosed, then they wouldn't have that side effect.
Although we did talk earlier about the wonderful advantage for the people who want to sleep through the night.
Correct.
So they could take that edible that might be recommended then, because they're going to take that amount and go to bed. They're not going to keep waiting for
that effect. So that's perfect for the chronic pain patient who can't sleep throughout the night because they may have metastasis to the bone. That's where the cancer has gone to the bone or the spine, and it's basically eating away at the spine. That's traditionally a very difficult pain to relieve. And what we would tell that person is maybe at 8 o'clock, vaporize to get relief right now, and also take an edible. So if you want to go to bed at 10 o'clock, by 10 o'clock, that edible is on board, and then the vaporization dose is coming down, that edible dose is coming up, and then you can sleep through the night for 6 to 8 hours. This is what it's unique about Lakewood Medical Clinic, is because our physicians really do take the time to give patients that education, because most of our patients don't know and don't understand, and we want them to have the best outcome very safely.
What many people think is that people are knocking on the door saying, oh, this is great. I'm going to say that I have chronic pain and I'm going to get high. I'm going to be able to just get right in on this. But what you see mostly are people who are really hesitant. They come to you, they know they have the qualifying condition, and they're still not even sure whether they want to go this route.
Correct. That is that it's almost in a sense of desperation, where patients, traditional medicine has failed them and hasn't worked. Other alternative medicine hasn't really worked, and now they're like, I need to have a better quality of life, and they're coming in for an evaluation to see if medical marijuana is beneficial for them. We pre-screen patients. Our population of patients are patients who have already been diagnosed with a qualifying condition, and now they need added therapy. It's not someone who was recently in the emergency department and they don't have an active diagnosis. That's not someone that's going to make it into our clinic.
A broken leg, broken arm, that is not chronic pain.
No, that's not chronic pain.
Yeah,
because medical marijuana doesn't suppress the brainstem like opioids can, it's very difficult to overdose and stop breathing. An overdose with medical marijuana is basically the munchies, is what's called the munchies, where you raid the refrigerator and you eat. Sometimes it can be associated with anxiety and paranoia, and it can last for several days, especially if patients overdose on an edible. But no one's ever died from marijuana alone.
Maybe somebody drank, had marijuana, drove a car, and died. But marijuana is not the primary cause of death, as opposed to something as simple as aspirin. And we all unfortunately know we don't give children of a certain age aspirin anymore because of the deaths, just simply from giving your child an aspirin.
Correct.
I have to wonder why you mentioned opioids a moment ago. They're prescribed by doctors all the time, and yet we have this terrible addiction problem in our society.
So those are federally approved drugs. Those are medications that we know and we learned about in medical school in our pharmacology classes. So from a certain extent, we are comfortable with with recommending them or prescribing them, but we don't have any background in medical marijuana because it's not federally approved. So our comfort and our knowledge base of medical marijuana is basically what mine was: very misinformed, very ignorant, and not useful or beneficial to patients. So physicians, we do what we know. And we had this long discussion about how we can have an entire conversation about how pain, being the fifth vital sign, has helped to contribute to people's preoccupation with pain, unlike any other time before. And I think that has led to, prescribing medications that patients may not have necessarily had to have for that particular symptom.
So may I ask, what's the best advice to creating the best life possible?
Sleeping.
Oh,
Many recent studies have shown that if you sleep, your risk of cardiovascular disease, your risk of a number of things, all goes down. Sleep. You should get at least 7.5 hours of sleep every single night. And there's some nights where we have to, stay up a little bit later, but make a good night's sleep a priority. Put your phone away, turn it off, don't put it by your bedside. Your patients that have insomnia, that are posting on Facebook in the middle of the night, don't let those alerts keep you up, but set yourself up for a good night's sleep.
what is your secret for aging gracefully?
Now I've incorporated exercise. I was not a big exerciser, even though everyone says you have to exercise. I get my exercise in 3 to 4 days a week now. I've joined a gym and I love it. It's my me time. I put my headphones on and I go out and I exercise and I feel great. And as I'm getting older, I realize I want a good quality of life as I age, and I want to be healthy. And the best way to do that is to set myself up for success now.
And I think the more we take care of ourselves while we're younger, the better it is as we're growing older. So live a longer, healthier life without regrets. Thank you so much, Dr.
Thank you.
Nelson.
I really
appreciate you being here.
Same here. I appreciate being here. I appreciate you.